special investigations in carcinoma buccal mucosa and advanced carcinoma GB sulcus. Some special investigations are done. First is orthopantogram. Okay, orthopantogram is used for planning the extent of mandibular resection. A tumor which is clinically very close to the mandible will not actually invade the mandible. You can do a CT scan to rule out, but actually one of the best investigation is orthopantogram. No need to say it in the exam. Only if the examiner asks, what do you know about orthopantogram, you can say that it is very useful in carcinoma GB sulcus. It is useful to assess the extent of need of mandibular resections. Okay. Dental extraction is advised. Dental extraction is done only to prevent the sharp tooth. Okay. Once the tumor has eroded already into the mandibular cavity, or it is about to erode into the mandible, you should not do dental extraction. Such tumors will easily spread into the mandible after extraction. Okay. It is about to erode, you should not do. Only if it is not eroding still, you cannot properly assess, or if there is a sharp tooth nearby, you do a dental extraction. And you always, oral hygiene is very important. You can get a dental colleague support for oral hygiene. Prosthesis should be identified. Those patients who need prosthesis should be identified before surgery, and such patients should be planned with the help of a dental colleague. Okay. And for carcinoma cheek and buccal mucosa and GB sulcus, surgeries will be extensive, and you need a preoperative assessment of the speech and swallowing of the patient. So you must know what the patient is going to get in the postoperative period, how much amount of speech impairment, swallowing impairment the patient is going to get, and you must be able to provide appropriate rehabilitation in the postoperative period. This is a picture of an orthopantogram. This was actually taken in a GB sulcus tumor patient. It was clinically very close to the mandible, but see here, the mandible's boundary is very much intact, no? You can see there is actually no invasion of mandible in this patient. Okay.